Welcome back to Today's Health. In this segment, we're going to talk about hiatal hernias with Dr. Bhesania. Doctor, can you please describe for us what is a hiatal hernia?
Sure. A hiatal hernia is simply put as a hole in the diaphragm. And the hiatus is the opening where the esophagus comes through the diaphragm. And it's a potential area of weakness, and people can develop a hernia. So a hiatal hernia is not a hernia you can see from the outside, and people point their abdominal walls, they have a hiatal hernia. It's not there. So it's on the inside and it's on the diaphragm.
What causes them?
So basically, like all hernias, you can be born with a hiatal hernia, so it's congenital, or you can acquire it. And conditions that increase the risk of acquiring a hiatal hernia are obesity, pregnancy, increased intra-abdominal pressure from straining or lifting.
And what are the symptoms of a hiatal hernia?
Typically, people will complain of heartburn. That's probably the most common symptom of a hiatal hernia. Very rarely we will have a piece of bowel or a body organ get stuck in a hernia causing a problem, but the most common complication would be heartburn.
So unlike the other types of hernias where you can usually physically see a defect, how do you diagnose this type of hernia?
So when people have complaints of heartburn, we will do a gastroscope, which is a telescope that goes down your mouth to look at the inside of the stomach, and you can visualize a hiatal hernia that way. Also, we have tests, a esophagram or upper GI where you drink barium. We can see it radiologically, and a CAT scan will also show a hiatal hernia.
And what treatment options are available for a hiatal hernia?
So if hiatal hernias are symptomatic, causing problems where people have heartburn or they're having issues with their hiatal hernia, we fix these, and these are typically fixed in a minimally invasive laparoscopic approach. And how we actually do it is we will actually visualize the hiatus, we'll find the hernia, we'll reduce whatever's stuck in the hernia. It could be fat, it could be a portion of the stomach, bring it back down into the abdominal cavity where it belongs, and actually close the hernia by suturing it. And this is all done laparoscopically. It's a procedure that takes about 35-40 minutes, and there's several small skin incisions, and people do well and get to go home the next day, and typically their symptoms are resolved.
And what is the anticipated recovery after this procedure?
So it's minimally invasive, so they're physically up walking like after surgery. They do spend one night in the hospital, and then they're back to work at a desk job within a few days. If they have heavy lifting involved in their job, and that's 20 pounds or greater, I typically keep people off of work for about 4 weeks.
Doctor, this has been great information. We need to take a break. We'll continue in a moment.